Hello everyone and welcome back to my channel. Myself Dr. Surbisani. Hope you are doing great. Now today I come forward to talk about the most important topic, that too for the theory exam, also that too of oral pathology, and this topic is also important for the NEET MDS examination. So it's my humble request that if you are new on my channel, do subscribe my channel and don't forget to press the bell icon. The importance of bell icon is that you can have the notification of my upcoming video, and don't forget to subscribe to my channel. Now back to the topic. Today's topic is the developmental disturbances, that too in the teeth. Now basically we need to know about the etiological factors which are responsible to cause the developmental disturbances in teeth. Basically, we need to know the etiology first, which will cause the developmental disturbances in the teeth. So, we classify it into two categories. One is the genetic factor and second one is the environmental factor. These two categories come under the etiological factors or the etiological causes. So, one is the genetic factor or the genetic cause. Second one is the environmental factor or the environmental cause, which further includes the trauma, radiation, infection, chemotherapeutic medication, endocrinal disturbances and intrauterine disturbances, any damage or the disturbances that occur at a time when the baby is in the mother's womb. Right? There are the disturbances that occur in the size of the teeth, number of the teeth, shape of the teeth, even in the eruption pattern of the teeth, or even in the infrastructure of the teeth. We are going to talk about the developmental disturbances in the number of the teeth. This is very important, and it is further divided into four parts. One is the anodontia, second one is the hyperdontia, also known as the supernumerary teeth, the post-permanent dentition. Third is the post-permanent dentition, and fourth is the pre-deciduous dentition. We begin with the first topic, that is the anodontia. Again, as our name suggests, anodontia. If we break this word, anotodontia, that means anotodontia means teeth. So, a no to teeth, that means there is the absence of the teeth, and that condition is known as the anodontia, right? Now, it could be further divided into two parts, but before we go into the classification of the anodontia, we need to know that what is the reason behind the condition known as anodontia, that is the absence of the teeth. So, the reason is the absence of the appropriate dental lamina. We all know with the theory and with the knowledge that the teeth usually develop from the dental lamina, if you know the basic very well, right? So, there is no appropriate dental lamina available, and that's why this condition can occur, that there is the absence of the teeth. Now we see the classification of the anodontia. So it is classified into two parts. One is the true anodontia, second one is the false anodontia. Now in case of true anodontia, it is further divided into two parts. True anodontia, one is the complete or the total absence of the teeth. Second is the partial or the incomplete absence of the teeth. Now, in case of the partial or the incomplete absence of the teeth, we have two new terms which are very important for you to understand. If there is the absence of the teeth, if there is the absence of only one teeth or more than one teeth but less than 6 teeth, that term is known as the hypodontia. But if the number of missing teeth or the absence of the teeth is up to the number of 6 or more than the 6, then that term is known as the oligodontia. So this is the further subtype or the category which come under the partial anodontia or the incomplete anodontia, right? On the other hand, the false anodontia means we do the extraction that is due to some reasons, and that's why it is known as the false endodontia. It could be the complete extraction, like complete extraction of the teeth, right? Or maybe the partial extraction. Again, the third category is the pseudodontia that come under the false endodontia. Now, pseudodontia is defined as the presence of the missing teeth because the teeth are right now in the unerupted form present in the jaw. So that condition is known as the pseudodontia. That means the tooth is there but it is not visible in the oral cavity, it is present in the jaw. And that's why clinically if we see a person's mouth or a patient's mouth, we see there is no presence of the teeth clinically, and that's why it is known as the pseudodontia. Now, there is one syndrome which is associated with this condition of endodontia, that is the head syndrome. One syndrome which is associated with the endodontia condition, that is the head syndrome, that is the hereditary ectodermal dysplasia syndrome. It contains the 3H. One is the hypodontia, that means the absence of the teeth. Second is the hypotrichosis, that is the normal baby born with the hairs on the head. But in the early childhood, there is the hair loss tendency. That condition is known as the hypotrichosis, or by spelling we say this just to make you learn, but the pronunciation is hypotrichosis, right? Now the third H in this syndrome or in this condition is the hypohidrosis. In case of the hypohidrosis, the person having the tendency to sweat less. That means the glands which are present in their body has the tendency to produce less sweating in the normal stimuli. As we compare one example, that the normal human being and the one person who is having the hypohidrosis condition, when they both run and come back, so the person who is normal have a normal sweating tendency, but on the other hand, the person who has this hypohidrosis condition has a less sweating ability. Moreover, now the biggest important point is coming now in this topic, that what are the teeth involved in this condition of endodontia. See, it is seen even in the deciduous dentition and it is also seen in the permanent dentition, right? So in case of the deciduous dentition and permanent dentition, the different tooths are involved. Say that which tooth is involved in this condition of endodontia. So in case of the deciduous dentition, normally the mandibular incisors are involved, and in case of the permanent dentition, the third molar and secondary premolar and the lateral incisors are involved. And more or less there is one stable condition and a very key feature to make you understand, and this is the very important point for the NEET MDS examination, that if you find in a clinical question, if you find that there is the missing maxillary central incisor and first molar, then you need to check for the ectodermal dysplasia syndrome in that case. Suppose let's say there is one child who is having the missing maxillary central incisor and first molar, and then they can ask you in a question form what is the syndrome it is associated with. Then you need to check for the ectodermal dysplasia. That means that child or that condition definitely refer towards this syndrome. So you need to check other points if they mention in the question, and then you need to take the right answer. Followed by that, there is one more syndrome which is there and associated, that is the Ehlers-Danlos syndrome, that is EDS. Its short form is EDS, EDS, EDS. So is the EDS. It basically affects the connective tissue of the body wherever it is. It basically affects the connective tissue which is made up of the collagen, involves the muscle, tendon, joints, bones. And if we see the key feature is the fragile blood vessels, hypermobility of the joints, atropic scarring, and the hyperelasticity. So these are the key feature of this syndrome. Followed by, now come to the complications of the anodontia. There are 4 complications with the anodontia. Hypodontia with the microdontia, that means there is the microdontia is also there and the hypodontia is also there. Second complication is the reduced alveolar development. Third complication is the delayed deciduous tooth exfoliation is there. Fourth complication is the abnormal spacing of the teeth. Now that's all about the first topic that come under the developmental disturbances, that too in the number of the teeth, and that is the anodontia. We read about the 2 syndromes, one is head and second one is the EDS. So don't forget this, this is very important. Now followed by that, the second topic which come under the category of the developmental disturbances in the number of the teeth, that is the supernumerary teeth, which is also known as the hyperdontia. Again, as a name suggests, dontia means teeth and hyper means more in number. So supernumerary teeth or the hyperdontia is a condition in which there is the increase in the number of the teeth and we see the multiple supernumerary teeth which is more than the normal condition. Now if we see the cause or the reason behind it, so localized hyperactivity of the dental lamina that can lead to the condition of the hyperdontia, that is the supernumerary teeth. Second, it can lead to the formation of the additional tooth germ also. And the third reason could be the avatism, AVATISM. Now what is avatism? Although this reason is not so true, as avatism means the occurrence of the condition which is there in the heredity or in the ancestral condition, it is reoccur again. But this last cause is not so much true. It is very rare condition. Now if we see now we are done with the causes of the supernumerary teeth. Now if we see what are the teeth involved in the supernumerary teeth, so paramolars, incisors as mesodents, right? Distomolars, that means the 4th molar, and the premolars. These are the teeth which are involved in the supernumerary teeth, right? Now as we know, the supernumerary teeth mean the multiple number of the teeth which are present in the oral cavity. So it acts as a multiple flowers which is present in a garden, right? And from this we got another syndrome with the familiar name known as the gardener's syndrome, right? So again, a very important question, definitely the question come on the syndrome. So this is the third syndrome, that is the Gardner's syndrome. Now if we see the Gardner's syndrome, so it has 5 things. One is the multiple supernumerary teeth, multiple osteomas, multiple polyps of intestine, and then epidermoid cyst and dermoid tumor, right? So these are the 5 parts of the Gardner's syndrome, and the link and the mnemonic and how you can learn this syndrome as by the number of flowers which is present in the garden. So number of teeth which are present more in number than the normal condition, right? Condition which we read under the topic of the developmental disturbances in the number of the teeth, that is the cleidocranial dysplasia. Again, there are 4 types of the cleidocranial dysplasia. One is the mesodents, that is the packed shaped teeth are present between the central incisors or between the incisors. Second is the tuberculate, that is the barrel shaped teeth are present in pair, that too parallel to the incisors. Third one is the odontome, that is the hamartomatous formation which we read in detail, that too later on in the oral medicine video, right? Followed by fourth is the supplemental, that is the duplication of the teeth, for example the lateral incisor, premolars and molars, right? Now, if we see the clinical condition of the cleidocranial dysplasia, it leads to the crowding condition followed by gingivitis, periodontitis, and later on, if the infection increases, it might convert it into the number of the cysts, multiple number of the cysts and the tumors, right? Now, pre-deciduous dentition. Pre-deciduous dentition condition include the two things. One is the natal teeth and second one is the neonatal teeth. So, natal teeth means already the teeth is present in the newborn as a baby born with the teeth. So, that is known as the natal teeth, right? And followed by neonatal teeth means those teeth once the baby born, after the first 30 days the tooth erupts. So that is known as the newborn ka teeth, so known as neonatal teeth. So basically the hornified structures are present on the gingiva which is appear as a teeth. Later on, if some infection or something is there, it can also associated and to be known as a cyst of newborn, right? If any infection or something like that is there. Followed by the post-permanent dentition, that is occur after the complete set of the permanent dentition is done. So the another condition is known as the post-permanent dentition. In that case, there is either the delayed eruption of the third molars of the full denture patients are there, but they have a unerupted third molars or the unerupted supernumerary teeth. So that condition is known as the post-permanent dentition. So that's all about the first part of the video regarding the oral pathology topic, that is the developmental disturbances of the teeth, and in that we have only covered about the one part, that is the developmental disturbances in the number of the teeth. Now in the next video we will do the questions related to this topic only, so that it will clear your basic as well as you can do the practice. That will helpful for you for your NEET MDS preparation as well as for the INSET. That's all about the today's video. Hope you like this video, then hit the like button. Thank you for watching.